Turmeric health risks. Turmeric is a vibrant yellow spice that has captivated cultures for millennia with its rich golden hue and sharp, earthy flavor. Valued in India's ancient Ayurvedic healing tradition and traditional Chinese medicine, this aromatic root has been used to improve digestion, liver function, and relieve pain. However, we'll dive into all the reasons why this supposed all-healing spice might actually do more harm than good. Understanding the nuanced risks of turmeric helps you make safer and more informed decisions so that you can reap the benefits of turmeric while also safeguarding your health. What is turmeric? Turmeric comes from the root of the Curcuma longa plant, a relative of ginger grown commercially across tropical Asia, primarily in India. The key bioactive compound giving turmeric its hue and therapeutic properties is curcumin. Used mostly to add a peppery and musky essence to dishes, turmeric is also famous for its potential healing properties. Dating back to more than 4,000 years, the turmeric spice has traveled far and wide, reaching all continents of the world. Turmeric emerged as a natural medicinal spice and became part of the ancient Indian holistic medical system known as Ayurveda healing. In Indian culture, turmeric is believed to be a sacred spice that protects against evil spirits. In the modern age, turmeric is not only a part of numerous delicious dishes, but it's also used as a supplement that promotes health. Modern studies show that the curcumin compounds found in turmeric can increase brain activity, memory, and cognition. But before you go swallowing turmeric supplements twice a day, be very careful. Turmeric can be detrimental in these medical conditions. Gallbladder problems. Consuming high amounts of turmeric may worsen existing gallbladder issues like gallstones or bile duct obstruction, impacting over 20 million Americans. Turmeric's chemical composition contains significant amounts of oxalates, a natural compound that can be found in various fruits, vegetables, grains, and even gallstones. Oxalate gallstones are produced when the body experiences high absorption of this compound. According to the American Journal of Clinical Nutrition, turmeric contains high amounts of oxalates, which can increase the risks of gallbladder stone formation and bile duct obstruction. Gallbladder conditions, such as gallstones, can manifest as upper right-sided abdominal pain, that is, spasm or cramping in nature. Gallbladder spasms can last minutes to hours and can be accompanied by other symptoms, such as nauseas, vomiting, chills, and elevated temperature. If you have a history of gallstones in the past, or if you are prone to gallbladder conditions, it's best to avoid turmeric supplements or turmeric spices from your daily meals. Those dealing with gallbladder issues or conditions should exercise caution when considering adding ginger into their everyday diets. Consulting a healthcare professional before introducing ginger is highly recommended, as its inappropriate use could potentially worsen gallbladder symptoms and slow down the recovery process. Kidney stones. Speaking of stones, the gallbladder isn't the only organ who is susceptible to damage caused by excess turmeric intake. The kidneys can be harmed if too much turmeric enters our system. As we've mentioned, turmeric contains high amounts of oxalate compounds, which accumulate to form hard stones. Oxalate stones can also be formed as kidney stones, which can interfere with the normal urinary system physiology. Just like gallstones, kidney stones can be the culprits behind numerous signs and symptoms. Kidney stones can manifest as spasmic lower back, lower abdominal or groin pain. Additional symptoms may be high fevers, chills, nausea, and vomiting. Depending on their location along the urinary system, kidney stones can be lodged within the exits of the kidney, along the urethra, or even in the bladder. If kidney stones find their way down into the urinary system, they can cause bloody urine, cloudy or foamy urine, and a painful or burning sensation during urination. Although numerous factors can contribute to kidney formation, oxalate stones are usually formed when there is not enough calcium in the intestine. Oxalate binds to calcium in order to be excreted safely in the stool. However, with insufficient amounts of calcium, oxalate has nothing to bind to, and instead of being excreted in the stool, it is reabsorbed into the bloodstream and excreted through the urine. A 2008 study published in the American Journal of Clinical Nutrition, ingestion of turmeric supplements for weeks on end can lead to a significantly higher urinary oxalate excretion, and thus the potential for oxalate stone formation. If you're already experiencing symptoms of kidney stones, it might be best to tune back on the turmeric supplements. Interaction with medication. Turmeric supplements can also pose potential dangers if combined with the wrong medication. An important, yet overlooked, complication of turmeric supplements is its interaction with medication, specifically with painkillers, blood thinners, chemotherapy medications, or antidepressants. According to Memorial Sloan Kettering Cancer Center, turmeric has shown to stop some chemotherapy medications from working against cancer cells. Studies reveal that turmeric and curcumin compounds can lessen the effects of certain medication, decrease their effectiveness, and even increase side effects. Specialist Pharmacy Service has shared a list of medications that can be altered with high intake of turmeric, as stated by the SPS. The risk of bleeding might be increased because turmeric may interfere with clotting by decreasing platelet aggregation. Use caution when turmeric or curcumin are taken with medicines or supplements that have anticoagulant or antiplatelet, blood-thinning effects. Imagine taking a medication to manage a health condition, only to find that its effectiveness is reduced because of your turmeric supplement. If you're on any medication, it's crucial to consult your healthcare provider before adding turmeric or curcumin to your diet. Iron deficiency anemia. The most common form anemia across the world, known as iron deficiency anemia, can be worsened with a high dose of turmeric intake. During iron deficiency anemia, the body does not have enough iron to produce hemoglobin, a protein in the red cells that are responsible for transporting and carrying oxygen to tissues and organs of the body. When the body can't produce enough hemoglobin proteins, it can lead to various signs and symptoms, ranging from general fatigue to pallor, weakness, hair loss, nail damage, and pica, an unusual craving for non-nutritive substances such as chalk or dirt. Recent studies conducted in mice explore the potential dangers of consuming turmeric with iron deficiency anemia. An experiment in mice showed how curcumin can bind to ferric iron in the gut, leading to a decreased iron absorption. By binding to ferric iron, curcumin can reduce the synthesis of the blood protein ferritin that stores iron and the hormone hepcidin that regulates iron utilization in the body. But what about in humans? A fascinating case report published in 2019 opened the door for research to investigate the potential downfalls of ingesting turmeric with iron deficiency anemia. This fascinating connection between turmeric and iron deficiency in humans can be attributed to a 66-year-old man who decided to self-treat his arthritis and myopathy using turmeric supplementations. According to the case report, the 66-year-old physician, who had been treated for a biochemical recurrence of prostate cancer, had developed arthritis and myopathy following his cancer treatment. As a way to reduce his daily symptoms, the physician decided to start daily turmeric and iron supplementations. Even after 4 months of taking daily turmeric and iron supplements, the physician's overall health didn't improve. Despite daily supplement use, the 66-year-old's laboratory work revealed low iron, ferritin, and hemoglobin levels. Surprised as the patient may have been, he came across articles that explored the effects of turmeric on iron binding and absorption. The 66-year-old physician decided to stop his daily turmeric supplementation intake, and to his shock, his iron, ferritin, and hemoglobin levels all began to steadily increase just after 2 weeks. Although this is a unique case of turmeric and iron deficiency, this case report can offer insight into potential new research. Heartburn and ulcers. Any type of medication or supplement has its recommended daily dose of intake, which has to be monitored and regulated. Overconsumption of turmeric supplements can lead to various side effects and potential health risks. It has been reported that large doses of turmeric supplements that exceed the daily recommended doses may trigger acid reflux, heartburn, diarrhea, headaches, and dizziness. An upset stomach may also exacerbate any active gastric ulcers, leading to more severe symptoms of heartburn, a burning or gnawing sensation in the stomach, vomiting, and diarrhea. Prior to embarking on a turmeric supplementation journey, it's imperative to first seek guidance from your medical professional and to obtain approval. Once you have the green light, make sure you also adhere to the daily recommended dose of turmeric supplements to avoid any potential side effects or unfavorable complications. Conclusion: although most natural remedies can yield positive effects on health, it's essential to address and consider the potential risks associated with combining supplements with existing health conditions. Thanks for watching. If you enjoyed this video, subscribe to our channel and comment below how you take your turmeric supplements. See you in the next one.